and like to put a big focus on wellness, especially when it comes to our heart, which is why we're at the Heart Hospital, McLaren, and actually in a cath lab. And joining me right now is Dr. Mccomb. How's it going?
Going wonderfully. Thanks so much for having us on today.
Yeah, well, thank you so much for letting us come into your lab. You guys do so much here, so much important things here, especially when it comes to the heart. But today we're focused on a little bit of the abnormal heart rhythms, which are treated here. So can you break down what that exactly is?
Yeah, sure. So the other word we use for abnormal heart rhythms is arrhythmia. There's multiple types. Most of them thankfully are benign, and many of us can suffer from these arrhythmias. The one we worry about the most is called ventricular fibrillation, or VFib, and that unfortunately can cause cardiac arrest. So that's the most worrisome arrhythmia that we talk about.
Yeah, and we have heard that word a lot, especially when we've done stories on Mike Garland and his story of recovery, thanks to you and others, people here, as well as the champions of the heart. So talk a little bit about what are symptoms of VRIB.
Yeah, especially with VFib, we talk about not only symptoms but more signs of it. Unfortunately, this arrhythmia causes your heart to stop fairly instantly, within seconds. So what you'll notice is a patient who goes through this loses consciousness. And if you learn how to check for a pulse, they really lose a pulse and they stop breathing and even start gasping for breath. So these are the common signs of VFib that we should be aware of.
Yeah, and when that happens, what are the next steps? Does it require heart surgery? What goes on? Yeah,
the next step is number one, CPR. So chest compressions, and the other is learning how to use a defibrillator, and that's what Coach Garland's foundation is so focused on. So that's what we look at is early defibrillations and restarting the patient's heart to bring them back to life.
Yeah, and what has it been like for you personally that has been able to work with Mike Garland and hear his story, but also hear the push for things like learning CPR or learning how to know those next steps so we can potentially save lives?
Yeah, what a worthy cause, because a gentleman who's very healthy, been an athlete his whole life, been a coach at Michigan State of Final Four teams for 20 plus years, who had just retired from that career and suffered that cardiac arrest while driving in a motor vehicle, you know, and then you can tell, and him being my patient now, you can tell that he's repurposed himself to learning what caused his cardiac arrest in order for himself, but really to help others as well. That's become a calling for him. And for this arrhythmia, the common thing for it is you have to be able to recognize it very urgently, like the good Samaritans who stopped John and Jason, restarted his heart, alerted paramedics, 911. The dispatchers did their job, and everybody worked as a team to save Coach's life and get him to us. You know, without those individuals who did this and got him to our cath lab, got him to our hospital, he would not be here today. And they gave us the opportunity for us to do our job. So that's really a nice thing, obviously.
Yeah, obviously, and we're so thankful for the job that you're able to do. And of course, you guys at home can do your job with all the information on your screen in terms of checking for your own health, but also getting involved so that you can learn all that can be found at the bottom of your screen. But thank you so much for everything and keep up the amazing work.
Awesome. Thank you so much for having me today.